Now the international panel have said, look, there's a pathway in place, so skin tear risk assessment, and I believe we should probably do these sort of pathways for everything, because if nothing else, it's an aide-memoire. So you look at your patient wound environment, look at the risk categories. How is the skin? What's the mobility like? What's the general health like? Does that add up to a risk factor, the same as you would do a risk factor for your pressure ulcers? If it does, we come to an at-risk. Is the patient any identified risk? Yes or no? We implement a risk reduction program, the same as we would if it was a pressure ulcer. So all this investment that we keep talking about is about pressure ulcers, pressure ulcers, pressure ulcers. Let's get the pressure ulcer categories down. But we do within PEL, this thing called PEL, which is our pressure ulcer review and learning panel. Everything that comes through with a wound is Datex now. And what we're finding is we're starting to get filtered through now, skin tears, and it's coming from, actually from mental health at the moment. So it's really interesting that we're starting to look at skin tears maybe in the same way. I would suggest you look at the root cause. You know, so when you get a pressure ulcer, we investigate, we do initial incident reviews, we do SIs, we do IRs, we do whatever they're called in your organisation. But maybe we should just do in our head a root cause of why did this happen in the first place? What do I need to put in place to stop this from happening again and causing harm? Because it could become a chronic problem, it could result in sepsis, it could become life-threatening to a patient.